Okay. Ready? And so what we can do today is we can critique each other. We can let each other know what we missed, what we need to work on. All right. Hello.
Hi.
Hey, I'm James with Respiratory Therapy. Can you verify your name and date of birth?
10 and 9 or 3299.
All right, very good. I am here to do a pulse oximetry and measure your heart rate. And it's very difficult once you do put once your hands are not dry. It's very difficult to put gloves on. So keep that in mind. It's almost an impossible task.
Is that a small?
It's a medium.
Oh.
So I do have different size gloves over here. So first thing I'm going to do is come in and I'm going to turn this on. So it's going to it takes a few seconds to calibrate and adjust.
James, we've done a lot of scenarios, but we've never done a scenario like, say for instance, the pediatrics and the parent. Do we address the parent in the room, or we just always go to the kid?
Yeah. You always address the parent in the room. Sometimes they don't want to know anything. Sometimes they want to know everything. So I finally got my gloves on. So I've already asked her name and date of birth. I've introduced myself. I explained the procedure. I think that's 1 through 5. And I'm going to use aseptic technique. I want to make sure my device is clean, my area is clean, and I do have some alcohol wipes that will clean this off with each use. So I'm going to use aseptic technique. I simply tell her that I'm here to do a pulse oximetry. Pretty simple procedure. All I do is I need a finger. So I asked her to, if she would give me a finger, any finger would work. I prefer to use the non-dominant hand, like the ring finger on the non-dominant hand. I did that a lot too.
Oh, that was terrible.
All right. So I'm gonna do a finger probe. You don't have to. You don't have to get that involved.
You can just say.
If they ask, I would explain it to them. Basically, you can say something as simple as, I'm measuring the oxygen in your blood. So we got it. We got an oxygen saturation of 100%. We've got a heart rate of 88, and our PI index is 1.7. And so in this case, I've got my readings, right? I've got my saturation, I've got my heart rate, I've got my PI index. I can see I've got a really good waveform. So I'm gonna call that a reliable reading. I'm gonna chart that. I'm gonna document that she's 99% on room air, very important. Her heart rate 79, and I've got a good PI index of 1 point, whatever it is, 1.1. But I'm going to show you guys quickly how we can alter that PI index. That's not what I want.
Could you go over room air again? You say you're going to document that?
Room air?
Yeah.
Room air is simply she's breathing room air. She's breathing roughly 21% oxygen. She's not on any oxygen at the moment.
You said 9. Oh, 99. You said room air. Okay.
Yeah, her saturation is 99%, and she's on room air. Now, if she were on say a 3-liter nasal cannula, I would document 99% on a 3-liter nasal cannula. Bear with me here. This is holding pressure. So I'm going to put this blood pressure cuff around her arm and pump it up, and we're going to see it's going to alter her PI index. We're going to ultimately lose that waveform, and her PI index is going to go from what it is now to close to 0. Okay.
Will it only change if you do it on the same, like, arm?
On the same arm, the arm that's receiving that blood flow. So if I do this on your right arm, it's not going to affect it. You mind changing that to your right arm? And I can also, and I'll show you another way too. So it's beeping saying that she's lost perfusion there. Put this here. I'm not worried about her blood pressure now. I just want to feel that being tighter. Okay. So as I increase that pressure, you can see we have a flat line now. We've lost our waveform, and our PI index is going down and down and down. And then as I release the pressure of this cuff, we're going to get our waveform back, and her fingers are going to turn pink again. Okay. So keep that in mind whenever you guys are getting a saturation on the patient. A lot of times our patients in the ICU will have a cuff on that's time cycled. Every 10 minutes, their cuff is going to go off and get a blood pressure. So we want to keep in mind that if there's a sat probe on that finger, it'll probably flatline while the pressure is on that arm. And I can also do the same thing. We've got two arteries that supply the hand. We've got the radial and the ulnar artery. Okay? If I were to compress both those arteries, the exact same thing would happen what we just saw. You mind if I do that? So we got if you palpate your pulse here, you can feel your pulse. And then on this side of your wrist, you've got your ulnar artery. And if I were to occlude both of those, we should get a flat line. I don't think I have your ulnar artery there. There we go. So we got a flat line, and we're losing our PI is going down and down and down. And as I release that, she's going to get perfusion again, and we're going to see a waveform. And her PI index is going to go back up. Okay, so remember the PI index is that pulsatile strength. And if I take away that pulsatile strength by occluding somewhere upstream, it's going to cause that to go down to almost zero. All right, how do you feel?
Feel great.
So at the end of this, I'm going to take that off. I am going to document. Oops, sorry. I'm going to take this off. I'm going to document this in the patient chart that she is, her SpO2 is 99% on room air. I'm going to document her heart rate. I'm going to document what the PI was, and then I'm going to make sure that she's safe and comfortable, and that my bed rail is I never put it down, but it's up. You never want to leave the room with the bed rail down. The patient could flop out of bed, and that's all on you, right? Break a hip, break their noggin, and that's all on you.
Are we wiping the probe?
Yeah, I need to get some more alcohol
Like
swabs.
before and after?
Before and after, yeah. It's important to do it after, especially if you have a contact precaution patient that you want to clean up after you use it. So, in the competency, you'll do that. Yep. So I verify that she's okay, she's comfortable, the bed rail's up, everything's safe. I've documented. I will leave the room, and I will foam out as I leave the room. Make sure we foam out. And that's it. Okay. I will leave that up.